this patient was referred to me for endodontic retreatment of tooth number 2. So that's the wisdom tooth, number 1, number 2, number 3. Number 2, as you can see, crown, previous root canal, and periapical lucency here. And what's going on here? This root canal was done by an endodontist, according to the patient, about 3 years ago. Recently, he started to have some discomfort and also noticed a little pimple on his gum. Went and saw his dentist, and his dentist told him that his root canal had failed and needed to be redone. So again, you need to examine the tooth. You need to evaluate the tooth yourself. Don't rely on another clinician's diagnosis. So again, you can see MB1, MB2, distal buccal and palatal here. We can see a periapical lucency here, but there is definitely something going on here. So let's look at a different angulation PA. Again, don't rely on just one angulation PA. You need multiple angulation PAs, at least one straight on, one from mesial to distal, and one from distal to the mesial to open the tooth up. This is another angulation. Look at the distal buccal. Look how short that fill is. Again, short fills don't matter, but in this case, the endodontist left necrotic tissue and bacteria behind here. You can see a periapical lucency. Again, look at what's going on here. This dark shadow, this radiolucent area. Tooth was tender to percussion and palpation. That's the tooth, and here's the sinus tract right there. You can see right on the marginal gingiva. All right, so what do we do next? We probe, right? So let's go ahead and probe this tooth. All right, so as we walk the probe just sinks right into this area right here. Yeah. It's at 9 millimeters right now. It could go more. Right there, that's 9 millimeters. So as you saw, the probing, the radiograph or radiographs, multiple angulation, the presentation of that sinus tract there, again, the probing, all point to a vertical root fracture. So recommended extraction, unfortunately.